Hello, my name is Dr. Jonathan Stockman, and I'm a veterinary nutritionist. And today I will be speaking about nutritional management of dermatological diseases in dogs and cats. This talk will include an overview, including the skin in terms of its structure and physiology, nutrients that are important for skin's health, nutritional management of dermatological diseases, some case examples, and a summary. So as you probably know, the skin is the largest organ in the body, and as such, it is one that shows clinical signs more often when we have nutritional deficiencies. The skin is comprised of the epidermis, which is the outer, more keratinized layer, a basement membrane, and then the dermis, which is a rich network of fibers, intracellular substance, blood and lymphatic vessels, and nerve and muscle cells. The epidermis is divided into layers by itself. The most outer layer is called the stratum corneum when we have the cells that are more keratinized and no longer alive or dividing. And these cells are important as the barrier function of the skin. Lower down, we have the stratum lucidum, followed by the stratum granulosum, and then the stratum spinosum, where we have Langerhans cells, which are the macrophages in the skin, part of the immune function of the skin. And finally, we have the stratum basale, which is the deepest layer, and that layer has melanocytes as well as tactile cells that are a part of it. The epidermis in dogs is a lot thinner than the epidermis in people, partly because in dogs and cats, we have a coat cover, which provides some additional protection. And so the epidermis doesn't need to be quite as thick. This is a histology of the skin. Again, you can see the stratum corneum, the outermost layers followed by the stratum lucidum, stratum granulosum, stratum spinosum, and finally the stratum basale. The melanocytes that are in the basal layer synthesize melanin, which is the pigment which provides color both to the skin and the hair. And this melanin is stored in organelles called melanosomes. We have hair that are, the hair follicles are present in the dermis and are usually diagonal to the surface to the epidermis. We have sebaceous glands, which are secreting sebum, which is an oily secretion, which provides both protection to the skin in terms of